I need to ask you something and I need you to answer honestly. If you were having a heart attack right now, would you know it? Most people say yes, absolutely. Chest pain, left arm pain, that is what a heart attack feels like. That is what every movie, every TV show, every health class has told us since we were children, and that belief, that confident, completely understandable belief, is quietly killing people every single day, because here is what the cardiology research actually shows. 45% of all heart attacks are silent, nearly half. No chest pain, no dramatic collapse, no moment where you think, this is it, call 911. Instead, there is a mild ache in the jaw that you blamed on your dentist visit. A strange heaviness in the shoulder you assumed was from sleeping wrong. A wave of nausea after dinner you thought was the food. An episode of breathlessness climbing the stairs you chalked up to being out of shape. And while you were explaining it away, your heart was in crisis. Right now, millions of people walking around completely unaware that they have already had a heart attack. Not years ago, recently, some of them in the last few weeks. I am going to show you today exactly what a silent heart attack looks and feels like, why it is so dangerous, who is most at risk, and most importantly, the specific warning signs your body sends weeks before it happens that almost nobody recognizes. Stay with me until the end. This video could genuinely save your life or the life of someone you love. Subscribe and hit the like button right now. Every person who finds this channel is one more person who gets information their doctor simply does not have time to deliver. I want to tell you about a patient I will call Dorothy, 71 years old, retired school teacher, sharp, energetic, walked her dog every morning without fail. No history of heart problems, blood pressure slightly elevated, but managed with medication. Cholesterol on the higher end, but her doctor was monitoring it. About 4 months before she came to see me, Dorothy started noticing something odd. Every afternoon around 3 p.m. she felt exhausted. Not tired the way you feel after a busy day. A different kind of tired. A heaviness she could not explain. She assumed it was her iron levels and started taking supplements. Around the same time her jaw started aching. Not constantly, just occasionally. A dull soreness she noticed a few times a week. She made a dentist appointment. The dentist found nothing wrong. She started feeling slightly nauseous after dinner some evenings. She switched to lighter meals, assumed it was her digestion slowing down with age. One morning on her walk, she felt a strange pressure in her upper back, between her shoulder blades. Not painful exactly, just uncomfortable. It passed after about 10 minutes. She mentioned it to her neighbor who said she probably pulled a muscle. Dorothy never felt chest pain. Not once. When she finally came to see me, it was because her daughter had noticed that her mother seemed different, slower, quieter, less like herself. I ordered an ECG immediately, then a troponin blood test, a test that detects proteins released by damaged heart muscle into the bloodstream. Dorothy had had a heart attack. We estimated it had occurred approximately 6 to 8 weeks earlier based on the imaging. A significant portion of her heart muscle had been damaged and partially scarred during an event she had experienced as jaw soreness and afternoon fatigue. She sat across from me in complete disbelief. But I never felt anything serious, she said. I thought I was just getting older. That sentence, right there, that is the sentence I hear most often in my career. And it is the sentence I want to make sure you never have to say, because Dorothy's body had been sending her signals for weeks. Clear, consistent, specific signals. She simply did not know what she was looking at. After today, you will. Before we go through the warning signs, I need to explain why a heart attack can happen without chest pain. Because for most people, that seems impossible. A heart attack is supposed to be the most dramatic medical event of your life. How can it be silent? Let me explain the physiology. Your heart muscle is fed by a network of arteries called the coronary arteries. Think of them as the supply roads that deliver oxygen-rich blood to the heart itself. When one of these arteries becomes blocked, either by a blood clot or by a plaque rupture, the portion of heart muscle that artery was feeding begins to die from lack of oxygen. That is a heart attack. The medical term is myocardial infarction. Myocardial means heart muscle. Infarction means tissue death from lack of blood supply. Now here's where it gets important. The chest pain most people associate with a heart attack comes from a specific type of nerve signal. A signal that travels through pain receptors in the heart directly to the brain and is interpreted as crushing pressure in the chest. But not everyone has the same nerve pathway sensitivity, and the location of the blockage matters enormously. In some people, particularly women, people with diabetes, and people over 65, the nerve pathways that would normally transmit that chest pain signal are less sensitive. Either because of age-related changes, because diabetic neuropathy has blunted nerve signals throughout the body, or simply because of individual anatomical variation. In these cases, the heart muscle is still dying. The damage is still occurring, but the pain signal never arrives the way it is supposed to. Instead, the brain receives confused, redirected signals. Pain referred to the jaw, pressure felt in the shoulder or upper back. Signals interpreted as nausea or indigestion. Signals that feel like nothing more than unusual fatigue. There is another critical factor. Many silent heart attacks occur in smaller coronary arteries, what cardiologists call the smaller branches of the coronary tree. When a smaller vessel is blocked, the area of muscle affected is smaller. The event is less catastrophic in the moment, but the damage accumulates, and the scarred tissue weakens the heart progressively over time. This is why silent heart attacks are in many ways more dangerous than recognized ones. When you have a recognized heart attack, the dramatic, painful kind, you call 911. You go to the hospital. You receive treatment within hours. The damage is limited. Intervention begins immediately. When you have a silent heart attack, you take some antacids and go to bed. The blockage may partially resolve on its own, but the damage remains. The heart muscle that died does not regenerate. And weeks or months later, when the next event occurs, it hits a heart that is already weakened and scarred from the first one nobody treated. Research from the ARIC study, the Atherosclerosis Risk in Communities study, which followed thousands of adults over decades, found that people who had silent heart attacks had nearly the same long-term mortality risk as people who had recognized heart attacks. The difference was that the silent group received no treatment, no lifestyle intervention, no medication adjustment. The heart attack was just as serious. The response was zero, because nobody knew it happened. Now I want to tell you specifically who is most vulnerable to a silent heart attack, because there are clear patterns and clear risk factors that make certain people far more likely to experience one. Women. This is perhaps the most important and most underappreciated fact in all of cardiology. Women are significantly more likely than men to have a heart attack without classic chest pain. Research consistently shows that women present with atypical symptoms, jaw pain, nausea, extreme fatigue, upper back pressure, far more often than men do. And because heart disease has historically been studied primarily in male populations, the medical community spent decades defining heart attack symptoms based on what men experience. Women were dismissed, sent home from emergency rooms with anxiety diagnoses, told it was stress or acid reflux. This is changing slowly, but not fast enough. Heart disease is the #1 killer of women in America, killing more women than all cancers combined. And silent heart attacks are a significant part of that story. If you are a woman watching this, your risk is real, and your symptoms may look nothing like what you were told to watch for. People with diabetes. Diabetic neuropathy, nerve damage caused by chronically elevated blood sugar, affects nerve fibers throughout the entire body, including the nerves that would normally transmit heart attack pain signals. Studies show that people with diabetes are 2 to 4 times more likely to have a silent heart attack compared to people without diabetes. Their pain threshold is altered, their warning system is compromised, the heart can be in serious distress while the person feels nothing more than mild fatigue. If you have diabetes or prediabetes, please listen to the warning signs I am about to share with extra attention. People over 65. Age itself changes pain perception. Older adults have lower sensitivity to visceral pain, the type of pain that comes from internal organs. The same event that would produce excruciating chest pain in a 45-year-old may produce only mild discomfort or no chest symptoms at all in a 70-year-old. People with high blood pressure and high cholesterol. These conditions accelerate the buildup of arterial plaque, the narrowing and hardening of the coronary arteries that sets the stage for a blockage. The higher the plaque burden, the higher the risk of a silent event. People who have already had a silent heart attack. This is the most sobering one. Once you have had one silent heart attack, your risk of having another, and of that second one being far more serious, increases significantly. This is why detection matters so much. Now we get to the most important section of this video, the warning signs of a silent heart attack, specific, detailed. The ones your body sends, sometimes weeks in advance, that almost nobody recognizes for what they are. I want you to listen carefully, and I want you to think about whether you have experienced any of these recently. Warning sign number 1, unexplained extreme fatigue, not ordinary tiredness, not the fatigue of a busy day or a poor night's sleep, a specific kind of exhaustion that seems disproportionate to your activity level. You did almost nothing today and yet you feel completely drained by early afternoon. A heaviness that rest does not fully relieve. This is one of the most consistent early warning signs, particularly in women, and it is almost universally dismissed as stress, anemia, thyroid issues, or simply age. What is happening physiologically is that a partially blocked coronary artery is forcing the heart to work harder to maintain output. The heart is compensating, and that compensation costs energy. Your body is diverting resources to maintain cardiac function and leaving you with less. If you have noticed a new pattern of unexplained exhaustion, particularly if it has developed over weeks rather than days, pay attention to it. Warning sign number 2. Jaw pain or toothache with no dental cause. This one surprises people every time. The heart and the jaw share overlapping nerve pathways. When the heart is in distress, pain signals can travel along these shared pathways and be felt in the lower jaw, the teeth, or even the neck. This is called referred pain. The pain is real. It is just being felt in the wrong location because the brain is misreading the source of the signal. The pattern to watch for: jaw discomfort or toothache that appears during physical exertion or stress and fades when you rest. A dentist finds nothing wrong. The pain comes and goes without clear dental explanation. Dorothy's jaw aching a few times a week was her heart sending distress signals she had no reason to recognize. Warning sign number 3. Pressure or discomfort between the shoulder blades. Not sharp pain. Pressure, heaviness, a vague, uncomfortable sensation in the upper back, between or just below the shoulder blades. Again, referred pain from the heart, traveling through shared nerve pathways to the upper back. The distinguishing feature: it tends to appear during activity or emotional stress and ease with rest. It may last several minutes. People commonly blame it on muscle tension, poor posture, or a bad mattress. Warning sign number 4. Nausea or indigestion that seems unusual. The heart sits close to the stomach and shares nerve connections with the digestive system. When the heart is under stress, it can trigger signals that are interpreted as gastrointestinal discomfort. Nausea, bloating, a feeling of fullness, or what seems like persistent indigestion, particularly if it is a new pattern, if it appears without an obvious dietary trigger, and if it does not respond to antacids the way normal indigestion would. If you have been taking antacids regularly for a new pattern of indigestion that developed over the past few weeks or months, and you have any other risk factors, please see a doctor before assuming it is simply digestive. Warning sign number 5. Shortness of breath with minimal exertion. You used to climb those stairs without a second thought. Now you need to pause at the top. You used to walk to the mailbox and back without any issue. Now you notice you are slightly breathless. When the heart muscle is damaged or struggling, it cannot pump blood as efficiently. The lungs compensate by working harder. The result is breathlessness, often during activities that would not previously have caused it. This symptom on its own has many possible causes, but combined with any of the other warning signs on this list, it becomes a serious flag. Warning sign number 6. Swelling in the ankles or feet. When the heart cannot pump efficiently, fluid backs up in the body, particularly in the lowest points, the feet and ankles. This swelling, called edema, can develop gradually over weeks. Most people notice their shoes fitting tighter, sock elastic leaving deeper grooves. Ankles that look slightly puffy by evening. Like the other signs, this is easy to attribute to standing too long, hot weather, or age. But new or worsening ankle swelling in someone over 55 with cardiovascular risk factors deserves medical attention. Warning sign number 7. Heart palpitations or a fluttering feeling in the chest. Not a racing heart from anxiety or caffeine. A different sensation, an irregular flutter. A feeling that the heart skipped a beat or added an extra one. Episodes that come and go without obvious trigger. Damaged heart muscle from a silent heart attack can disrupt the heart's electrical system, producing arrhythmias, irregular rhythms. These may feel subtle, easy to dismiss as nothing, but a new pattern of palpitations in someone over 55 should always be evaluated. Warning sign number 8. Unusual anxiety or a sense of impending doom. This one sounds strange, but it is clinically real and well documented. Some people experiencing a cardiac event, or in the days or weeks leading up to one, report a persistent, unexplained feeling that something is wrong. Not worry about a specific thing. A general sense of unease that they cannot shake and cannot explain. This is believed to be the brain's response to abnormal signals coming from a heart under stress. The brain cannot identify the source clearly, but registers that something in the body is not right. If you or someone you know has been expressing this kind of inexplicable anxiety, particularly alongside any of the other warning signs, take it seriously. Now, How many of those 8 signs have you experienced in the past few weeks or months? One of them alone may mean nothing, but 2 or more together, especially in someone over 55 with high blood pressure, diabetes, or high cholesterol, is a pattern that deserves an ECG and a troponin blood test. Today, not next month. Let me tell you specifically what to ask your doctor for. Because walking in and saying, "I think I might have had a heart attack," without knowing what tests you need puts you at the mercy of a 12-minute appointment. Walk in knowing exactly what you want. Test 1. The ECG electrocardiogram. This is the first-line test. It measures the electrical activity of your heart and can show patterns consistent with previous heart muscle damage. A silent heart attack often leaves a specific signature on the ECG called a Q wave, an abnormal deflection that indicates an area of scarred heart tissue. This test takes 5 minutes. It is painless, it costs almost nothing, and it can reveal damage from a heart attack that occurred weeks or months ago. Ask for it by name. "I would like an ECG, please." Test 2. Troponin blood test. Troponin is a protein found inside heart muscle cells. When heart muscle is damaged, as in a heart attack, troponin is released into the bloodstream. Elevated troponin levels in the blood are one of the most sensitive and specific markers of heart muscle damage available. A high-sensitivity troponin test can detect even small amounts of troponin, the kind released during a smaller, silent event. Ask for it specifically. "I would like a high-sensitivity troponin test." Test 3. Echocardiogram. This is an ultrasound of the heart. It shows the structure and function of the heart in real time, how well each chamber is pumping, whether the walls are moving correctly, whether there are areas of weakened or scarred muscle. An echocardiogram can clearly identify regions of heart muscle that have been damaged by a previous heart attack, even a silent one, by showing areas that are not contracting as strongly as the surrounding tissue. If your ECG or troponin raises any concern, an echocardiogram is the next logical step. Test 4. Coronary calcium score. This is a specialized CT scan that measures the amount of calcium, a marker of plaque buildup, in your coronary arteries. It gives a score. A score of 0 means minimal plaque. A high score means significant arterial disease and elevated risk of a future event. This test does not diagnose a past heart attack, but it tells you clearly how much plaque burden you are carrying and how urgently you need to address your cardiovascular risk factors. It is quick, non-invasive, and increasingly available. Ask your doctor whether it is appropriate for you. Write those 4 tests down: ECG, high-sensitivity troponin, echocardiogram, coronary calcium score. Those 4 tests together paint a complete picture of what has happened and what the risk is going forward. Let me be direct with you. If you have experienced 2 or more of those 8 warning signs recently, jaw pain, extreme fatigue, shoulder blade pressure, unusual nausea, shortness of breath, ankle swelling, palpitations, or unexplained anxiety, do not finish this video and move on with your day. Call your doctor today, not tomorrow, today. Tell them specifically, "I have been experiencing symptoms that concern me about my heart, and I would like an ECG and a troponin test." If your symptoms are happening right now, if you are feeling chest pressure, jaw pain, arm heaviness, or severe shortness of breath as you watch this, stop watching. Call 911 immediately. Do not drive yourself. Do not wait to see if it passes. But for those of you who are watching this as a precaution, as information, as something you want to share with a spouse or a parent, let me give you the practical steps that reduce your risk significantly. Step 1. Know your numbers. Blood pressure. Cholesterol, specifically LDL, your bad cholesterol. Blood sugar, specifically HbA1c, your 3-month average blood sugar level. These 3 numbers are the foundation of cardiovascular risk assessment. If you do not know them, your first task is to find out. Step 2. Take your medications as prescribed, and take them at the right time. Blood pressure medication skipped every few days is not the same as blood pressure medication taken consistently. The same goes for statins, blood thinners, and diabetes medications. Consistency matters more than most people realize. Step 3. Address the things that accelerate plaque buildup. Smoking. If you still smoke, stopping today is the single most impactful cardiovascular decision you can make. The risk reduction begins within 24 hours and continues for years. Hidden dietary salt. It drives blood pressure higher day after day. Remove the salt shaker from the table. Reduce processed food. Read labels. Sedentary behavior. Sitting for more than 8 hours a day is now classified as an independent cardiovascular risk factor. Not because you are not exercising enough, but because prolonged, uninterrupted sitting impairs vascular function. Break it up. Stand up and walk for 2 minutes every hour. That simple change has measurable cardiovascular benefit. Step 4. Learn hands-only CPR. If someone near you collapses, the first 10 minutes determine survival. Hands-only CPR, no mouth-to-mouth, just firm rhythmic chest compressions at 100 beats per minute, can double or triple survival rates until emergency services arrive. The American Heart Association has a free 90-second tutorial available online. Every person in this household should watch it. Step 5. Trust your instincts. Dorothy knew something was wrong. She felt it, but she could not name it, could not explain it specifically enough to feel justified going to a doctor, so she waited. If your body is telling you something is not right, you do not need to be able to name it precisely. You do not need to have all 8 warning signs. You do not need to convince anyone. You are allowed to say to your doctor, "Something feels different and I want to be checked." That is enough. That is more than enough. The worst outcome of going to the doctor and being told everything is fine is a wasted afternoon. The worst outcome of not going is what happened to the heart muscle Dorothy lost on a Tuesday afternoon when she thought she was just tired. Dorothy is doing well now. After her diagnosis, she was started on appropriate medications, referred to cardiac rehabilitation, and made specific lifestyle changes. Her heart function has stabilized. She walks her dog every morning still, but now she walks with knowledge. She knows what her body is saying. She knows what to listen for. She came back to my office 6 months after her diagnosis and said something I think about often. I wish someone had told me this 10 years ago. That is why this channel exists. Not to replace your doctor, not to diagnose you through a screen, but to give you the information that a 12-minute office visit cannot deliver, to help you walk into that appointment, knowing what questions to ask, what tests to request, and what symptoms deserve attention instead of dismissal. Heart disease does not always announce itself dramatically. Sometimes it whispers, a tired afternoon, a sore jaw, a pressure in the back that comes and goes, and the question is whether you are listening. Your action steps from today. 1. Think back honestly over the past 4 to 8 weeks. Have you experienced any of the 8 warning signs? Unexplained fatigue, jaw discomfort, shoulder blade pressure, unusual nausea, shortness of breath, ankle swelling, palpitations, or a sense that something is wrong? Write them down. 2. If you have 2 or more, call your doctor today and ask specifically for an ECG and a high-sensitivity troponin test. 3. Know your 3 numbers: blood pressure, LDL cholesterol, and HbA1c blood sugar. If you do not know them, make an appointment this week to find out. 4. Share this video with someone you care about: a spouse, a sibling, a parent, a friend who has been dismissing symptoms. You may not know whose life you are protecting by sharing it. 5. Subscribe to this channel and hit the like button. Every subscriber makes it more likely that the next person searching for answers actually finds them. The healthcare system is built to respond to emergencies. This channel is built to prevent them. I will see you in the next video.